asking for senior help and working within your limits. So you're an F1 and you've been asked to go and deal with something. Could be anything. Someone's fallen over, someone's got a low oxygen saturation, someone's got temperature, whatever the problem is that you've been asked to deal with. Day one, this is going to be you. You're going to go there, you're not going to have a clue what to do. You're going to phone your registrar and you're going to say, sorry, I've been asked to see this man with chest pain on the ward and I have no idea what I'm doing. And that's going to be kind of the first time you see anything, because I think you don't understand a thing until the first time you've seen it. So the first time you see any kind of problem, like, the first time I saw a septic patient or a PR bleed, or, someone who's having a seizure, whatever the thing is. And there's a limited number of common things that are going to happen. But I think until the second time you've seen a thing, there's a couple of people waiting. Let me just let these guys in. I think the first time you see a thing, bear with me 1 second. Let me work out how to let these people in. So the first time you basically come across a problem, you're not going to have a clue. By day 100, this is going to be you phoning your registrar. Okay, you're going to say, could I ask for your advice? I've just reviewed a 63-year-old man on the ward who was admitted 2 days ago with a cough and is now complaining of central chest pain. He doesn't have a documented history of cardiac disease, but he's a heavy smoker. He's currently being treated with IV antibiotics for suspected pneumonia, but his last CRP was only 20. He's also on omeprazole and statins. I've had a look at his chest x-ray, and there might be a patchy area that could be pneumonia. His oxygen sats are currently 85, but otherwise his obs are normal. I've examined him, and his heart sounds are normal, but he's still complaining of chest discomfort. I've asked the nurse to do an ECG, and I can't see anything obvious on the ECG. But I would you be kind enough to have a look at it for me? And is there anything else you'd like me to do? So you can see the progression from day 1 to day 100, because you can see from that F1 has looked, I put some arrows there, you can see they've read the documentation and they know the background of the patient. They've looked at the patient's recent results, like their CRP and their chest x-ray. They have looked at the patient's obs. They've examined the patient, and then they've thought, okay, this person has chest pain, so obviously I need to do an ECG. They've done an ECG, they've asked the nurse to do an ECG for them, and they've tried to have a look at the ECG. So they've really done quite a lot themselves before phoning up the registrar, okay? So I think that's that is the way you progress. I think that's how I've progressed, and I know that's how Mahad's progressed, and that's expected to progress. Day 1, you're not going to have a clue. But day 100, you will have a clue for most things. And that's kind of how you're going to learn. Is that fair, Matt?
Yeah, I've progressed as a junior doctor, but clearly not with my internet connection. Yeah, I think it's something that you learn. I think being a junior doctor or a doctor in general is the same as life, as in that you'll panic about something that's kind of silly, and then you'll learn it later on. It's just that, unfortunately, and fortunate, depending on how you look at it, something a little bit more dear is on the line this time, but is never on you alone, at least as long as you're speaking up, is never on you alone. And I think what I've learned, the main thing I've learned as a junior until now, I think I've been working for a year and nearly 7 months now, is how to communicate with everyone, really, your patients, and generally with your team and the people around you, is how to communicate. People will listen to you if you speak, and if you sort of know more or less what you're talking about, but you're sort of firm with your words and everything like that, people will listen to you. So,
I mean,
and you'll
it's
progress,
difficult.
definitely.
It's difficult. I definitely found it. You know, you have to be lucky to have a really good team. You know, but
Definitely.
I think workplace like relationships can be quite difficult in terms of like nurses are busy, this person's busy. That it's very easy to, you know, get on the wrong side of people sometimes. And but I think people cut you a lot of slack when you're starting out, and then they'll expect more from you, I guess. But it genuinely, the learning never ends. When they say it's like lifelong learning, it really is, because now I like, as an ST1 in peds, I started like from zero. I didn't know what a baby was and had to start, and I've learned so much in 6 months, which is what I kind of wanted to show in the first slide, that I was like, even like intubating babies and doing lumbar punctures, and you know, in such a short amount of time. And I've just finished that job, and I'm now going to start my next job on Monday, which is going to be like children up to age of 16. So that's going to be all new again to me, and I think that's how it goes. So we've all done 6 jobs before, you know, by the end of F2, often in 2 different hospitals. So that already gives you so much variety of experience, which I think is one of the advantages. You know, I've heard so many people, I've heard some people talk about, you know, they just want to be a neurologist, they want to go somewhere and they want to do that, or they just want to, you know, they want to be a vascular surgeon or whatever. But you know, you've got your whole life and your whole career ahead, and this is the opportunity to like just explore different things at a very junior level and just see how different things work. So I think that's one of the advantages as well. So in terms of like,
Sai, quickly
yeah, go
before
on.
you talk about that, I think there's 2 questions in the chat. So one is from Marta. If you're in a non-training position, you don't have official learning sessions, you sort of go to them if
Yeah,
there
so
is
we're
space.
gonna
Correct
talk
me if I'm
about,
wrong.
we're gonna
Okay,
talk about like
sure.
what learning. There's no such thing as official learning sessions. There's no.
Yeah.
We'll talk about what learning actually involves.
Yeah.
But
And the second one, I
yes,
think it's too general, Subha. I think is, I mean, the only bit of advice I can give you is just if you see something that, you know, is difficult, or is a sort of the hospital environment, you just throw yourself at it and make the mistake, and then you'll learn it, you'll pick it up after. The worst thing you can do is say, oh, I'm not going to try that just yet, or I'll call someone else to do that. Okay. I think the best thing you can do is try it. You know, if you have difficulty, get someone else to help you out. And assimilating to the hospital environment, the best thing is to speak to someone there that's, you know, in that new hospital. Find someone. It's difficult sometimes to find the right person, but if you can find someone that's quite nice and kind enough to give you moments of their time to sort of get you into how the hospital works, then that will be very helpful. Because I think half of
is the question basically about if you're struggling to cope, or is it like when you
no,
just
it
don't know?
says, do you have any advice about how to assimilate the most from the hospital, the most you can from the hospital environment as an F1, F2?
I think
And
it's just like learn.
yeah,
It's like joining a new uni, isn't it?
exactly.
It's kind of like
Yeah.
you join. You hope you have nice people you're working with, and fingers
Exactly.
crossed you will. I mean, you might not always get on with everyone, but it's the same as it's the same as joining any environment. There is no introduction. Like usually you have what's called an induction, which is maybe a day, 2 days, kind of max, and that's just a formality. So they'll just basically do paperwork and stuff, and that's literally it, and then you just kind of start. So that's why I wanted to talk about what F1 involves, because no one will explain that to you. Nobody is gonna, like, if you're starting as an F1, it's kind of assumed that you know what your role is. And I found that there was a short period where I didn't really know what I was doing, just like everyone else. But there was a much longer period where I just wasn't great at my job because I wasn't able to take the initiative And as I said, kind of, I was waiting on other people to kind of prompt me sometimes, because I just at that stage, I just didn't have a really good, you can't be good as a team player unless you really kind of understand, whereas some people are whereas really good F1s are so proactive. So being completely honest about my experience, that's kind of, that's the issue. When you start, you won't have like an introduction or an induction about really what your job involves, and the people that are kind of, the people that organize the induction are just they're going to be admin staff. So I'm starting a new job in a new hospital next week. I'll probably have Monday and Tuesday induction, and then I'm starting on Wednesday. But induction is literally like, they're going to make you an ID badge, they're going to set up your email stuff. But and then Wednesday, it's hit the floor running. It's literally like, I'm going to be new. The reg is probably going to be new. There's going to be a couple of sick kids, and we're just going to have to wing it. And that's how it always is, which actually I'm fine with. At my level, it's not an issue. But as an F1, just be aware that there's not really, they do offer like a shadowing period, but it's not going to be of much use. It's not going to be of a huge amount of use, which is why I just wanted to try and say a few things today that I think would be relevant to point out, to put into context what an F1 is, who are the people more senior to you, what do you do on ward round, what do you do on an on-call, how do you approach a bleep, how do you ask people for like help when you have a clinical problem? Because I think those are things no one's gonna like spend time to really explain to you, because everyone will assume you kind of know it. Is that fair, Mahad? Is that kind of similar to how you've found things?
Yeah. I mean, luckily, when I was starting as an F1, the F1 that I was taking over from was actually quite nice to sort of take a little bit more time with me, explain things. So depending on, who you see, shadowing might be a little bit more useful. And obviously shadowing an F1 is much more useful than shadowing a registrar or shadowing a trainee, or because there's so much of a difference between where you are and where they are. But I guess what Sai's saying is probably the truth, because you're only going to be shadowing for probably less than a week, because the other one is going to be stuck in a postgrad center, watching some videos on how the IT system in your hospital works and forgetting all of it. So the shadowing is going to be like you're learning on the job. That's the whole point of the job, is you're learning on the job.
Yeah.
I think the best piece of advice I can give anyone that is going to be a junior doctor in the UK, or even a doctor in general, is just be like, don't worry about it. I know that you think, every single breath that you take in a hospital is, going to be the difference between life and death for someone, which is not the case. And you just need to sort of take a deep breath in, take a step back, and see what you can learn that day, and then the next day, and then the next day, because you're not going to come in the finished article. And I think for me, like as a person, I'm really hard on myself and like how I want to do things and everything. And, it took me 3 months to actually sort of get that, be relaxed and be myself again. In the first 2-3 months, I was sort of on edge, always nervous. But I look back and I think like it was probably for no reason. I mean, obviously there is a reason, but if I look back, I think what advice I would give to myself, it would be relax, definitely relax.
I mean, it's easy to say, but I think anything that's outside your comfort zone is going to push you. I mean, often like, you come across a first year medical student and they're stressed until up here for their anatomy exam and their physics exam. And maybe as a third year or fourth year, you're like, hey, that's no big deal. But we all remember at that time it was a big deal for us. So I think that's the point of it.
Yeah. that's the point of it. You're supposed to have that stress is what makes you learn. You know? If you don't have that stress,
Yeah.
generally you won't learn. And putting yourself in that in a situation of stress,
Yeah.
a controlled situation of stress,
Yeah.
is what you need to do later on as well. You know, obviously in the beginning you're just going to be in total panic, but later on, if you want to keep learning something, progressing, putting yourself in that situation of a controlled stress will help you learn.
Yeah. And the other thing I want to say is that, you know, most people will be fine. There's obviously going to be, there are going to be some people that will struggle, just like there are some people that struggle at med school and find that med school isn't for them and things like that. And I just want to say that I think in the kind of culture and environment these days in the UK, in the kind of foundation program, is way more progressive than it was, you know, in you know, my parents, when my parents were junior doctors and things like that, because there's so much awareness of mental health issues. So if I mean, I know of, you know, my colleagues and stuff who have struggled, and there's a lot of help. I mean, they will really support you. They're not going to dismiss your issues. You know, not everything's perfect, but I think it's a lot better than it was in the past. So I think that there's a kind of a lot of mentory, supervising type people who will try and help you, and there is also further along, a lot of specialties now are offering the possibility of working less than full time. So, you know, things like pediatrics, GP, A&E type specialties give you the option of choosing basically not to work the full hours, but work either 60, 70 or 80%. So one of our good friends who's in my year is currently a GP trainee in the UK, who graduated with me in Milan. And she basically, having gone through F1 and F2, felt that, you know, she found the hospital environment quite overwhelming, and she was happier doing less hours. So she is now in her first year of training to be a GP at 60% hours. So she only works, I don't know what that comes to, it probably comes to 3 or 4 days a week. So 60% of normal people's, you know, other people's hours. And she gets paid 60%, but she feels it's much happier. And for her particular situation, it means instead of becoming a GP after 3 years, she will take 5 years, but she's much happier that way. So there, you know, further down the line, there's a lot of things that you can think about that will kind of support you. What I want to say with this slide is that the majority of the F1 job is service provision. So you're basically doing a job. You are the dishwasher, the vegetable peeler, or the errand boy. Although it's called training, that is the training. The training is doing your job. It's basically an apprenticeship. So it's like if you were building a ship or working as in a carpenter or working, you know, joining a plumber or whatever, you're doing the job that everyone else is doing, and that's how you learn. And when you come across things that are new to you, more experienced people are going to advise you. But that's it. No one, you know, there might be a little bit of teaching here and there, just like when you go to the hospital, some, you know, consultant might tell you this or tell you that, but not that often. And it's not, the structured training is basically your rotation. So you do 4 months of this, and then you do 4 months of that. And so I think most of you know that the F1 12 months involves 3 4-month rotations, and then your F2 involves another 3 4-month rotations, and they have to include some surgery, some medicine, and then in England it has to involve at least one job that's in the community, so outside the hospital, which is either GP or psychiatry. So it's 6 jobs that are going to be a variety of things, and that is your training. It's not someone sitting down with you training you. So to be completely clear, and then obviously you will learn to do procedures, and you'll be doing procedures, and then basically working within your limits and asking seniors. That what's most important is not your training. You are doing a job, the patient's care and the patient's safety is the #1 priority. So you have to have very realistic expectations about what others are going to do for you, because everyone is busy and they are looking after the patients. They're not there to spoon feed you or babysit you. You're there to turn up on time, do your job, and leave. Maybe ask questions when it's appropriate and when there's time, and maybe learn other things, but really you're doing the job is what I would say. And only doing what you're comfortable, only doing what you are able to do. And then always making everything is about the patient's safety. So what I talked about earlier in terms of, if the consultant's given you a plan, following that plan to the T, making sure the tests are done, making sure the results are followed, making sure when you've got the results, you do something about the results, whether they're normal or not normal. All of that is about the patient having their care. And your learning is basically a side effect of doing that. It's a side effect of seeing the patient, seeing different things happen, seeing how other people deal with it, having some experiences on call. What are you going to do when someone has chest pain or falls over or starts coughing or has a temperature? But all of that is service provision mostly. And I think the reason why training sounds, people think that training is longer in this country compared to maybe in other places, is because we have more exposure to different specialties. We have a more broad base. There is a lot of service provision, but that is what we've signed up for. If you think about it, you've actually, most of you at some early point wanted to serve your patients. And sometimes serving your patients literally means doing very menial tasks. It doesn't always mean doing very doctory things. Is that fair, Mahad? That's kind of what I would say about like why, some of the things that's maybe slightly more frustrating about being.
Yeah, sorry, I was just trying to troubleshoot while you were talking and help out on that side. Yes.
Service provision.
So it is service provision. You're looking after patients. What training are you getting? Is sort of, I feel like I'm sure, hopefully, all of you have had enough of just reading a book, and you want to sort of see it in practice and do something in practice. So somebody telling you, or something about how something works, and looking sort of standing behind you to see if you're doing it right, etc. It won't happen as a junior doctor most of the time. You can get a good relationship with someone and ask them to teach you something, and it can happen, and I've done that many a time with different things that I wanted to learn, and luckily managed to do it. But you're learning on the job, you're seeing the patients, and you observe and sort of go back to your book and sort of see that and see how that changed to sort of what you learned before, etc. So it's sort of a different approach to what you've learned before, and I feel like it consolidates, at least when you see what you've learned, it consolidates that much better than just reading it in a book, and you remember it much more easily. You definitely remember how to manage an asthma attack if you see one, rather than if you read it from a book. So that's what it is you're going to see patients, you're going to be doing sort of mainly managing around what happens, requesting this test, doing this blood test, etc. But you're also hopefully, and if obviously it all depends on yourself, learning while you're doing that, and then later on, it all depends on, like I said before, your communication, your relationship with the person that you're working with, and hopefully a good person or people, and then you can sort of try and take snippets and ask them to train you in certain ways. For example, for me, I'm not interested in surgery at all. I'm definitely not, probably not the right type of person to be a surgeon, but I feel like on my general surgery rotation, I learned quite a lot. And for example, I'm very interested in ultrasound, and in my general surgery rotation, we had trauma calls to attend, and I asked our registrars to train me on fast scanning when we were going to the trauma calls. And I managed to sort of later on learn how to fast scan patients while I was on trauma calls. So there is opportunity
Yeah, there are
to
some.
learn things fairly informally, but is all about sort of doing your job. And then once you do that, you know, getting that relationship with someone and trying to sort of push your, let's say, push your agenda and push your learning yourself. And you can do that. You can definitely do that.
I'm just conscious that we've already gone on more than an hour, so I'm gonna try and get
so
to
we can
like
wrap it up.
there's only a couple of slides, and then we can hopefully answer people's questions. And so
I think
procedures. I've got a couple of procedures here, but really, when you start, you're not going to be expected to know procedures. You're going to learn procedures. I think probably the only thing that's helpful to maybe have practiced and maybe be a little bit confident is just taking bloods, which you can see like the picture on the far left is you know, just someone taking bloods. I think is really useful. Then I've got a picture of ABG and cannulating, but I mean, you know, I didn't know how to do those things when I started. It took me ages to kind of learn. You know, I think throughout my F1, F2, I was never very good at cannulating at all, and now I'm cannulating babies fine. So, you know, don't worry about it. I would say if you have you know, there's loads of opportunities to learn to take blood. So I think that's useful because it's a kind of thing that's a bit of a boring job that they'll get the F1 to do and just be like, you know, these 5 people need blood, so they'll get you to do that. But most, you know, you will be learning things. Don't feel that you need to come into it knowing everything. So in terms of what exactly, we've talked about that you're basically doing a job. So what does a foundation program expect you to learn while you're doing that job? So there is a curriculum. It's called the F1 curriculum, and you can find it online. And most of it's quite general. I've got it up here, and I've put a couple of arrows to a few things that I think are important. So the first one is recognizes, assesses, and initiates management of the acutely ill patient. So essentially, recognizing when someone is unwell. You know, what's the difference between someone who's sitting there completely well, someone who looks very unwell. So it's basically as simple as identifying someone who's unwell and making a start, knowing when to call for help, knowing when to press that buzzer, just recognizing that something's not right. So you will see enough unwell people that after a year you will know how to do that. Prescribing safely. Prescribing is something you obviously haven't done as a med student, and is one of those new things and is a little bit scary. You'll start on day one and you won't know how to give someone paracetamol. Someone will be a bit constipated and they'll be like, "Doc, can we have some laxative?" You won't know how to give a patient a laxative. And then you will feel amazing when you give someone a laxative because you worked out how to write it down. So, you know, you're going to start from nothing. But prescribing is important because, you know, when you get into the rhythm of things, you will know what things to prescribe and how to do that safely. So again, it's all about patient safety. And then I've put an arrow for CPR because that's, again, a thing I hadn't done as a med student that was new to me. But you know, there's not thing someone's going to expect you to have done.
You will learn that. You will do an ALS course once you
you'll do an ALS course,
start as an F1,
yeah.
and you have either 2 days or EALS 1 day of actual training on how to do it. So
which is very enjoyable. It's very enjoyable. So you'll have fun with that, and you'll do the you will study a bit and do the PSA exam, which is about prescribing. Which I don't know whether it's necessarily very useful for teaching how to prescribe, but you will learn. You will do that as well. And then this is my last slide. Basically, I have so there's a thing called the Careers Destination Survey, which at the end of your F2, everyone does a survey in terms that asks them what their plan is after F2. And it's quite interesting because it kind of tells you what people do after those 2 years. So in 2019, a third of people chose to go to specialty training straight after F2. So I'm one of those people. And of those a third of those people went to GP training. So GP training is by far the most popular specialty. And it's not something you need to think about now, but you know, during one of the outcomes of your F1, F2 is it's also supposed to give you an opportunity to explore different careers and different specialties. So as an F1, as an F2, you will meet so many different people, and you'll have an idea of, what jobs look good, who has a good work-life balance, what you like about different things. So I am very much in the minority in that I chose to start my specialty training right after my F2. So I applied actually quite early in my F2. So it's August to August. So I applied in November of my F2 year. So I only had basically, I had only done 4 jobs when I applied. I'd done my 3 F1 jobs, and then I had done 1 F2 job before I started. So I kind of had to prepare fairly early on, but I'm very much in the minority there. The majority of people aren't going to do that. So 60% of people took an F3 year. An F3 year is basically like a flexi year, like a year where you do what you like. You work a bit, you travel a bit, you go to Australia, whatever. And when you work, you're filling in shifts that haven't been filled. So, if someone goes off sick or something, and they're very high paid. So in F3, people make loads and loads of money. So it's a very, very attractive thing to do. I didn't choose to do it, but the majority of people, as you can see, do choose to do it. 13%.
So that's if you're locoming, isn't it?
Yeah.
Also, as an F3 year is basically you do what you want.
You do what you want, yeah.
Yeah, exactly.
Yeah. So
if you're locoming, that's what Sai is saying. If
Yeah.
you can do an F3 as what we call a clinical fellow, which you're not earning ridiculous amounts of money. You just have a set contract similar to sort of what you're doing as an F2, but you do it in an area of interest that you want to sort of see for longer, for example. Let's say you want to be a neurosurgeon.
A lot of people get to F2 and don't have they're still not quite ready to apply. They're not ready to commit. So you might if you haven't really explored what something you're interested in, you might take that year to do that. 13% of people take a career break. 2 people want to do further study. Crazy people, I don't know who they are. I think I've missed it out, but I think it was like 0.3% of people left medicine. So really not a large amount of people, and people leave med school for all kinds of reasons. So, and if you have time, Google it, because it's an interesting document and it has different questions that people have been asked. I've just put 2 up there. I've got, did people feel they had a good work-life balance? So 40% of people agreed that they did. Quarter of people disagreed, and a quarter of people put neither agree, no disagree. So basically a minority of people, 44% of people thought they had a good work-life balance. 4% of people strongly disagreed. I would probably put myself in I don't think I had a good work-life balance, but everyone's different. And I guess it depends what job you're in, how well you adapt to different stresses, and what kind of hobbies you have. So everyone's different. That's an interesting question. The other question I've put here is, did your specialty choice change during your foundation year? So 36% of people said no, it was still their first, they still wanted to do the same thing even after going through the F1 and F2. The kind of half of people, their choice did change. 7% of people did, tried their specialty, but actually found they didn't like it. 17% of people discovered they actually preferred another specialty, which I think is interesting. So, I mean, personally, I always knew I wanted to do peds, but I always told myself to keep an open mind and not pigeonhole yourself. And I think that's really important. Don't have a fixed idea about something, because so many things about your circumstances might change. So always be open-minded. I think we should stop there and see if people have questions, because I had an idea of what I wanted to talk about. I don't know if it's what you wanted to hear about or what kind of questions you had. So please, if we've taken a lot of your time, feel free to leave the conversation at this point. If you have questions, please drop them in the chat, or just unmute yourself and just ask. I think, just unmute yourself and ask.
And thank you for your time and
taking.
I mean, it's probably a nice Saturday in Milan or wherever you are. So.
And I don't know many of, I can't identify many of the names. So if you want to, before you leave, just write where, whether you're from Unimi or from